Okay, let's go ahead and get started. I want to thank again you all for participating today and for participating in the Day of Action, particularly at a time that is very different and interesting, and participating in a way that we haven't done before, which is usually we go to the actual offices and hold meetings. And so this will be a bit different for all of us. And I thank you all for joining and for walking through this new and unique process with all of us. So thank you for that. I also want to apologize if you hear any background noise. I am at home with my windows open because it's a beautiful day out, but there may be some noise coming in through my window, so I apologize for that as well. But I'm going to go ahead and get started. I first want to just repeat what I mentioned earlier, 2 key points. One is that we are recording this meeting so that we can share it with everyone who is here and those who haven't participated, so that everyone feels prepared and ready for the Day of Action. And so this recording will be shared after today's presentation, so you are being recorded, just so you are all aware. The other aspects that I want to mention is that I have put everybody onto mute so that we limit any background noise. We still want to hear your questions and want you to be engaged, so please, you will see a chat box at the bottom where you can enter questions or comments, and I will address those as the time comes. And then right before I introduce Betty Lou, which she will be talking about, I want to mention again the unique time and circumstances in which we're operating this day under. We, of course, as all of you know, are seeing a big surge in the number of STD programs that are being either engaged in the response to coronavirus or having to withgo some services or operate in new and unique ways. And so for this Hill event, we want to be sure that we're really highlighting that and taking into account the unique environment in which we operate under. So a lot of the talking points that you will be hearing today will be focusing on that in particular and on what is happening with coronavirus. And for those of you who participated in the past, this will be a new and unique way of engaging in our talking points that we haven't particularly used before. So I just want to give that as a caveat before I introduce Betty Lou. Now, without further ado, Betty Lou Taylor, I think some of you on this call I know have engaged with her in the past. Some of you may be new to meeting Betty Lou, but she is MCSD's consultant. She's had years of experience on the Hill and in particular with appropriations, and so is really an expert at how to craft and engage and craft messages and engage with Hill leaders. And we're thrilled to have her with us today to give a bit of a background and 101 on how to engage in Hill meetings. And I believe that she will target it more so for how to engage in Hill meetings via the phone as we are doing this time around. So without further ado, Betty Lou, I turn it over to you.
Well, good afternoon, everyone. I hope you all are home, staying safe, wearing masks, trying new and exciting recipes, and well-stocked with toilet paper. So with that, I'll begin the presentation. What we're going to cover today is Advocacy and Education 101. I'm going to talk about how to communicate with Congress, what your message is, helpful hints, the status of the FY21 appropriations legislation, and then the COVID-19 stimulus packages, and those are supplemental packages for FY20. So rather than waiting until the end to ask questions, let's make this interactive. So please ask questions as I go through the slides. So I want to talk about the power of advocacy and education. So advocacy and education is public support or recommendations for a cause or a policy. Lobbying is an attempt to influence specific legislation or government regulations. Advocacy and education, so that's any activity that influences policy. So you're talking about a policy problem, the rising STD rates. You're seeking change to address it. How can you address it? More funding, educating people about what disease intervention specialists are. Lobbying has a strict legal definition. you're asking a policymaker to act on a specific piece of legislation, or you're asking for specific funding in an appropriations bill. You're also asking others to ask the same thing. So educating members of Congress and their staff does not make you a lobbyist. So there are many groups that come to Congress each year asking for various policy changes, funding issues, and it's very important for you to educate officials about the value of your work so that they know what you do is worthwhile and it's a good investment in taxpayer dollars. Because your work is largely behind the scenes, you need to educate officials about what you do. Tell them what you do at the state and local level, how a disease intervention specialist works, and then the long-term effects of STDs. Not treating STDs contributes to the spread of the disease, the long-term health care costs of that disease, and the long-term disabilities. Congenital syphilis is a perfect example, so you might use that when you're advocating on the Hill. Now, nonprofit organizations are not permitted to lobby Congress, but as state directors of STDs, most of you do have restrictions, but you can advocate for education, tell them what's going on in their state. What you can't do, you can't ask for increased funding for STDs, you can't criticize the administration's budget requests, and you can't criticize the administration's policies. Lobbying. Lobbying is very often treated as a bad word. In some instances, lobbying can jeopardize an organization's tax-exempt status, but you can make your views known within limitations. Lobbying has a very specific definition by the IRS, and that's on this slide. An organization or individual will be lobbying if they attempt to influence legislation by contact by letter, by email, or any other means, urges the public to contact members or employees of a legislative body for supporting or opposing legislation. Advocacy. So many of you probably have questions about how you can advocate and educate. You can conduct congressional visits in your home state. You can invite members of Congress to your offices. You can take them out in the field to show them what you do. You can educate Congress about the actions that will jeopardize your federal, state, or local funding as a tax-exempt status. You can tell your story about the success of your STD programs, the national rates, the state statistics, and none of the tools I mentioned run afoul of lobbying restrictions. Many organizations also come to Capitol Hill, and you all have done that in the past. And these meetings don't involve influencing legislation. All you're doing is telling your story, talking about the rates in their particular districts, the rates in their states. So I hope this gives you a clearer picture of advocacy versus lobbying. And I'll stop there to answer any questions that you might have.
And again, please feel free to submit any questions you have in the chat box, and I will be sure to raise them. I see one person typing. All right, I think we can move ahead, Betty Lou, and I will be sure to raise that question. Oh, sorry, here it is. The question is, can you possibly give an example of how an issue can be presented in an advocacy way versus a lobbying way, like asking for funding to teach providers about PEP? And PEP is
you can't ask for specific funding. What you can say is because of the amount of funding that the state gets, I can't do X, Y, or Z. So you're not asking for funding, you're just telling them what you can't do. And if you had more funding, you could teach providers about PEP, but because of the funding restrictions, because of the lack of funding, you can't do that right now.
And I should clarify a couple of things too as we get into our talking points. For some of you who are nonprofits and not directly employed by or get grants from the state, you have less restrictions in terms of how you can communicate things on the Hill. So that will also be a different conversation for you in terms of being able to say, ask for funding. But for those of you who do work directly with the state or who are engaging in this because you have direct grant funding from the state, that will limit your ability to be able to do ask for funding. And that's where you want to do what Betty Lou just mentioned, which is explain current, say without the amount of funding that we currently receive, we are unable to do X, Y, and Z, or if we were to receive more funding without giving a specific funding amount, we would be able to do X, Y, and Z. And those are two ways of addressing that. Otherwise, I'll turn it back over to Betty Lou.
Okay, the next slide is degrees of advocacy and education. So calls, emails, and emailed letters and tweets. You can visit congressional or district offices, participate in grassroots advocacy, play a leadership role in your organizations, or run for office. So why advocate and educate members of Congress? So what you're doing, you want to promote the interest of the patients, families, and the general public. So there's strength in numbers. So your Capitol Hill days, that makes a big difference. Enables individuals to do together what you can't do alone, and because that's where the dollars are. So your Hill visits have a great impact on educating and informing members of Congress and their staff on the rising STD rate. Health legislative assistants on the Hill, they have a meeting every Monday morning, and they talk about the meetings that they had the previous weeks and the points that the advocacy groups make. So your meetings with these health staff really make a big difference. So on your visits, you discussed the legislation or the funding in the bills or what you could do with more funding. These health staffs will remember your discussions and weigh in on the legislation. And then when they're writing talking points for their members, those recommendations will be based on your discussions, and they'll remember the high STD rates in their state or in their districts. So effectiveness of the communication. So the most effective and least effective. So these are ranked by the most on the top, the least on the bottom. So personal visits to DC, right now it's telephone calls. Personal visits to district offices, it's conference calls. Phone calls, emails, tweets, faxes, personal letters, petitions, and mass mailings. So faxes and personal letters are no longer effective. After the anthrax attack, all of the mail is now taken off-site before and disinfected before it's sent back to the state. So if you send in a letter or a package, it has to go off-site, it's treated, it's left there for a few days, then it's sent back to Congress. So that's why you don't want to send letters anymore. You want to do conference calls right now, emails. Those are the most effective ways to communicate with Congress at the present time. Scheduling meetings. This slide actually shows you who to call, how to schedule these meetings. It gives you telephone numbers. It gives you the emails. And these House websites will provide you, if you, on this next slide, it shows on the House website at the top right, if you type in your zip code, it will tell you who your representatives are. And on the Senate side, in the left-hand corner of the screen, it'll give you your senators by state. And there's telephone numbers and contact information there. So before you walk through the door, before you do your conference calls, you need to define the issue, determine your message, craft a strategy, frame your message and arguments. What do you want and why? Who will it help? How is it relevant? What will your opponents say? So basic tips for your visits. Start by thanking the member or their staff for their time. Tell them who you are, who you represent, and why you're here. Ask how much time they have for the meeting and tailor your message accordingly. Most of these phone calls, visits are 15 to 20 minutes. Be cordial, but limit small talk because you don't have time. Be assertive, but not aggressive. Don't get upset if the phone call gets rescheduled because members of Congress pull staff off to do other things all the time. Most of your phone calls this time will be with staff. They won't be with members, but staff are the ones that make the recommendations. So if you've got a health staffer on the phone, it's just as good as when you're meeting with a member. Be prepared to do the meetings under unusual circumstances. A lot of times when we do Hill meetings, we've got to do them in the hall or in the cafeteria. You won't have that problem this time. This is all conference calls. And if for some reason you can't do the call, be sure to email them and cancel it. Don't ever not make the call, and don't ever be a no-show for a meeting. So you need to know your story, know your audience, keep it simple, but stay on message. Do not use STDs, STIs, don't use any abbreviations at all. Personalize your message, explain the program, what you do and how your work impacts the community. And if they ask you a question that you don't know, it's not a problem. Just say, I'll get back to you on that, and then just email them with the follow-up. Offer yourself as a resource. Say, if you're writing a speech and you need some statistics from the district or the state, please let me know. I've got them right here at hand. I'll be glad to email them to you. Invite the member or the staff to tour your facility or your office or go out into the field with you. And if someone says, yes, we'll do that for you, wrap up the phone call. If it was a personal meeting, you would exchange business calls. In this situation, you need to make sure they have your email address. And take careful notes about the issues and questions on which you can follow up. So your message. I'm here today to talk about STDs. It's important because it's at a 20-year high. My research shows in your district X, Y, and Z. Let me give you an example. You might give them an example of a particular city that's got a big STD rate or a congenital syphilis rate that was, that's on the rise, that, wasn't there last year, now you've got 10 cases. That's why I'm asking you to, and the asks we will discuss in a few moments. So here are examples of things that you can talk about at your meeting. I'm here today to talk about STD prevention. The majority of STDs has been deployed on COVID-19. So all of your disease intervention specialists and the other support staff have now been deployed to do contact tracing for COVID-19. COVID-19, as you all know, our public health system and infrastructure was not ready for this pandemic. We didn't have enough personal protective equipment in the stockpiles. We didn't have enough staff. So you can sort of point that out as your talking points in some of these phone calls. You want to talk about it, disease intervention specialists. A lot of people on the Hill don't understand what that is. So it's a very important point, and we've been trying to make that point, especially in the COVID-19 response, because while COVID-19 is, of course, the critical pandemic at the present time, STDs now will be on the rise because there's no contact tracing. There's no prevention at all. So you can expect to see in the next 4 to 6 months, once people are able to start tracking STD data again, you will see a huge rise in the STD program, and that's something you need to point out. It's been estimated that 1 to 2 people with an STD will experience an STD over that lifetime. Hill staff are absolutely shocked about that statistic. They look at us, some of them are, I think they're actually quite frightened at that statistic. They are just amazed, so that's a good talking point to make. My state is largely supported through federal STD funding through the CDC. Due to limited resources and the new response to COVID, my program has been required to do much more with less. And here is your ask. you're asking to support $500 million for STD clinics, responses to COVID-19, and then supplemental package number 4. They've already passed 3 packages. This ask would be for package number 4. In package number 3, we ask for $200 million for disease intervention specialists. The Centers for Disease Control has not decided how they're going to distribute that money. The supplemental 3 requires them to send a spend plan to the Hill within 30 days of enactment. So we should see a spend plan within about 15 days to see if any of that money is going to go for disease intervention specialists. The other ask you can ask your members to do is submit a floor statement to discuss the STD program, their role in COVID-19, or their response to rising STD rates in the U.S. Tweeting or sharing a Facebook post about STDs, you can ask them to do that. Hosting an online Hill briefing or a panel on STDs, and coming to visit an STD program or clinic or go out into the field with you once this COVID-19 crisis is abated.
Betty, do you mind if I pause you for just a minute and just mention a couple of things that you had on that ask, the talking point slide that you just had? Mm-hmm. First, I want to mention I shared, everyone should have seen this in the email, and it's also under the Files tab on this webinar. If you are searching for that, you can pull that up. The other piece I wanted to note is you will notice at the end that there is a financial ask that Betty Lou mentioned. That's the first point. For those of you who are part of nonprofits, not associated with state or federal governments, you can make that ask. So for those of you on the call who can do that, please feel free to make that ask. For those of you who are part of state programs who can't make that funding ask, we are going to try to pair as many with you as possible with someone from NCSD who can make that funding ask, to be specific. And then finally, I want to make the point in terms of a little bit about where that $500 million funding ask came from. We have, again, in response to coronavirus, heard from many of our states the 2 points that Betty Lou mentioned. One is around disease intervention specialists and really wanting to be sure that we're supporting them as they're responding to coronavirus and being contact tracers. And I can share, I realize I did not, but I can share more background information about that ask with you all as well. And then the $500 million ask in this next supplemental is for STD programs who provide STD services normally, a linkage to care for HIV and that PEP question that Ian asked earlier, and wanting to be able to, as they shutter doors and transition also into being testing sites for COVID, is not only support them in the transition to testing sites, but then also support them when they reopen their doors to be able to take in the number of clients who will be needed for the surge capacity once coronavirus is over. So that's a little bit of the background on that ask. I will share more background documents about that with you, and I'll touch on at the end some other information I'll share. But just wanted to give that background. I saw, Linda, that you had a question around the specificity of the $500 million funding ask, and hopefully my response touched on that. And then Betty Lou, do you mind if I just ask one more question that came up during that?
Sure.
So Ian asked, when presenting stats, is it worth knowing the source and how the stat was calculated? For example, according to the Center for Disease Control and Prevention, half the people will experience a sexually transmitted disease. So is it helpful to have the source in the stat for offices?
Are you asking me the question?
Yeah, or I can answer it, but I was giving you
the stat was it's from the stat is from the Centers for Disease Control. We can send that to you if you'd like.
Well, I think the question is it helpful for offices to know what the source is when you give them the stat? So is it helpful when presenting different stats to staff members to have the source for it as well?
It's helpful because they want to know, if this is from a federal source. And so I would use the CDC. I mean, most of our statistics do come from the Centers for Disease Control. So I would say, according to the Centers for Disease Control, 1 in 2 people will get an STD over their lifetime. Yes, it's helpful to have that. Or if you have stats from your state, you can say, according to our state database, we've got 10 cases of congenital syphilis, and this is an increase of 5 cases over 6 months ago.
Right. So it's helpful to also have your specific state data as well, besides just the CDC level that we give. And Dina, I do see your question, and we will send all sources. And I think that's it for questions. So back to you, Betty Lou.
Okay, some phrases you can use if the meeting goes off the rails. Now, generally, that's in a congressional office on a face-to-face meeting. You probably won't have that issue on a conference call. But here are some phrases you can use to get the meeting back on track. So before we move on, let me just add, or you can say, I understand why your constituents are concerned, but our concern is STD rates are on the rise. Or you make an important point, and I'd like to come back to this fundamental issue of STD rates, what we can't do with the current funding situation. Or the most important thing to remember is, or the bottom line is, or the real issue, or let me be clear. So that's kind of some of the phrases you can use if things get off track, people start talking about other legislation or other issues that are current issues of the day. Health staff may ask you the following questions, and don't panic if they ask you something that you don't know the answer to. Just say, I don't know the statistics, or I don't know that answer right now, but I will get back to you, and then be sure to follow up with an email. So they may ask, why are STDs on the rise? Why should people care about STDs? How does federal funding support prevention? Are you receiving more funding? And if you receive more funding, how would you spend it? And that's a common question that we do get on the Hill. Are STDs linked to the opioid epidemic? How do STDs relate to HIV? How do STD programs work? How does the funding flow? And what are the main STDs and why do they matter?
And just to note for you all on those commonly asked questions, that was also a document that I shared and can be found in the files as well with some sample responses to those questions. So the meeting isn't over when it's over, so you need to offer yourself as a resource again. Address any unanswered questions by email. Provide feedback to your government affairs people. So if you get a lot of questions, or if you've got a particular office that's very interested in disease intervention specialists or congenital syphilis, please let us know so that we can follow up with those offices, and we can also target those offices when we're asking for support in Dear Colleague letters. Stay in touch with the congressional office. So if you see in your state or in your district that you've got a hot spot of congenital syphilis or a hot spot of chlamydia, you might send the newspaper articles or the statistics to that office and just say, FYI, I wanted you to know that we're having big issues here in Cleveland or big issues here in Tampa. That's very helpful for those congressional offices. That also helps the congressional offices do tweets, or they might want to do a floor statement. So it's important to keep those local, state and local issues, keep them informed of those issues. So again, here is the funding ask. During the fourth stimulus package, COVID-19 stimulus package, you want to allocate $500 million to support state, local, and tribal STDs clinics as this is significant service network transitions to the coronavirus testing sites. So that's what we're asking for in this fourth stimulus package. You need to send this material to the congressional offices, the state fact sheets on STDs, info sheets on STDs and COVID-19, and any congressional letters. Are there any other questions? I didn't cover FY21.
Given the current situation with the COVID-19 stimulus packages, it's unclear what's going to happen to the FY21 appropriations bills. The House has sort of made some noise that they might try to mark something up in May, in late May, and take those bills to the floor in June. The Senate has not mentioned any action at all as to what they might do with FY21 bills. It's clear that FY21 will be in a continuing resolution. That means that funding will continue at the FY20 rate until sometime after the election. So come September 30th, you will see a continuing resolution to continue all funding at last year's rate for some time after the election. We're thinking maybe December. It could be that it would be January or February of next year. It's just unclear because of the COVID-19 crisis as to how they're going to handle future appropriations bills.
And just a bit of background on what Betty Lou just said about FY21, that's fiscal year 21, and a bit of understanding of the process of what she just said in terms of a continuing resolution is what usually happens during our day of action in April is that we usually, our focus is on asking for money in the next fiscal year bill, which will go to support STD programs for next year. In a typical, or often not so typical, but usually what the ideal is that in the spring, appropriations committees in the House and Senate are discussing their funding asks and coming up with a package and numbers that will then be voted on by the House and Senate, ideally in the summertime, to be ready for the new fiscal year, which begins in October. That often doesn't go as planned, and that's when you need a continuing resolution to keep operations moving forward. And so in the past, we have usually focused on funding requests for fiscal year 21, but again, because Betty Lou mentioned this is a unique time, we won't be. And because at the time that you will be having these phone calls, the Senate and House will be considering this supplemental package number 4, which will directly affect our STD programs. So just a bit of background on that. And then as Betty Lou mentioned, are there any questions from any of you all before I get into final information around meetings and what I'll send everybody before the meetings as well? And I can also unmute you all at this time, but please make sure that you mute yourself or mute your own phone line if you have any background noise.
Hey, Taryn, this is Leo. I wanted to make sure that I was understanding correctly. STD directors cannot do the funding ask. Is that correct?
Yeah, so STD programs, STD directors and state health programs usually cannot do the funding ask because they're directly funded by the federal government, and so it would be considered a conflict of interest. So that's usually why we will pair you with someone from NCSD who can, after you give your educational information that Betty Lou talked about earlier, can specifically jump in and say, now that you've heard all this information, we are asking for this specific number or these resources to be able to support these programs and all the important work that they do. So NCSD, we usually try to pair them specifically with state offices to be able to do the ask on your behalf.
Okay, thank you.
Thank you.
Hey, Taryn, it's Linda Ferraro.
Hey, Linda.
Hey, I'm just wondering, I did see something in one of your emails that you were anticipating having some of these appointments already scheduled, all the calls. Do you know if that's going to be rolling out or if we're going to be doing any of setting up for the calls?
Sure, and let me provide then now a bit of information for everybody in terms of where we're at with meetings and other information that I'll share with you. So I did send meeting requests on Monday of this week to the different offices in which you'll be meeting with. For many of you, like Linda, it's folks that you met with last time, so you'll be seeing familiar faces. For those who I did hear a response from, I sent a calendar invite with the call-in number. I haven't, specifically for you, Linda, heard responses from any offices yet, which is not unusual, given in the past, usually they take some time to respond and also don't always set up meetings until even a week out from when the meeting time is, and then even more so now as they're responding to requests around coronavirus and are in that level. So if you haven't seen an invite from me, don't be discouraged. It just means we haven't heard back yet, but hope to in the next couple of weeks. Some of you, you will have seen calendar invites. That's not your final agenda for the day. I'm just adding them to keep track of them on everyone's schedule for myself, for you, and for the offices who we're scheduling with, as well as making sure we have that dial-in information. I will be sending, once your schedules are final, I will be sending out a Word document to everybody with your schedules for that day according to the time in which they're happening, and it will include the person that you're meeting with and their contact information as well, should, as Betty Lou mentioned earlier, you need to cancel or reschedule a meeting. I have tried to be cognizant of the time constraints that everyone has sent and are trying to set up meetings within those time constraints as well, so hopefully there won't be any challenges with that. And then just briefly, in anticipation of this possible question, the information that I did send you, including the commonly asked questions and the talking points, and the research document for your own purposes are really to help all of you prepare talking points and background information that you may need. I will be sending next week information along with the schedules of what will be shared with offices as Hill handouts that, again, Betty Lou mentioned in her slides, Hill handouts to each of the offices. I will be sending those ahead of your meeting so that they have them, but I want each of you to have them as well so you know the background of what you're speaking to, and I'll send those next week. In particular, we're updating one of the background documents that focuses specifically on STD programs and coronavirus to go along with the talking points we talked about here today. So that will have all of that information in it as well. And then the other main thing will be state STD data documents and some jurisdictional documents for those on Appropriations Committee, thanks to great research done by Johnny Cross, who's joining us on the phone today too. So a big shout out to him for that. And I will share all of that information next week, as well as hopefully a finalized schedule for everyone. Any other questions?
Karen, it's Linda again. Sorry.
Sure. No worries.
Just a quick question about since this is going to be, not face to face, and we're not going to be able to hand out, like fact sheets and things like that in person. Would you recommend that we, once we have our appointment and everything set, that we kind of forward information beforehand so that they can have a chance to look at it, and then it maybe kind of preps the meeting a little bit?
Yep. So as I mentioned, I will be sharing some Hill handouts with the offices before you meet with them, so that they have it in preparation of the meeting. I don't want to do it too early because it'll get lost in the shuffle, so I'll probably do it just the day before. So if there's any additional background information you'd like me to share, please share that with me, and I'll CC all of you on the emails that I send to the offices with this background information or Hill handout material. So please, if you have additional supplemental information specific to your state you'd like to have passed along, or to your programs that you're representing, please do share those.
Thank you.
Any additional questions for myself or Betty Lou? All right. Well, I hear none right now and see none in the chat. But if you do have any questions between now and the 21st, please do not hesitate to reach out to me or Betty Lou. I can also pass along questions that you have to Betty Lou as well. So please let me know if you have any questions in between that time. Otherwise, I really want to take a moment to thank Betty Lou for sharing this great knowledge, and also to thank all of you for hopping on this call, for being so engaged and willing to participate in this day of action and your presence on the 21st. And with that, I'm going to end the meeting unless you have anything else to add, Betty Lou.
Nope, that's it. Everybody just stay safe, stay home, wear your mask.
Yes. Absolutely. Please stay safe.
Wash your hands. As your mother always told you, wash your hands. I can hear my mother every day.
Yeah, for sure. All right. Thank you all. Thank you so much. We appreciate it. Bye.
Thanks.